Pelvic health issues such as pain, fibroids, incontinence, endometriosis, and abnormal bleeding can have a major impact on a woman's lifestyle. These problems can range from being inconvenient and embarrassing to debilitating and painful. The good news is that expert help is available through the Norwalk Hospital Pelvic Health Center. You'll hear about this new center on this week's Helath Talk. We're up next. Hello, I'm Dr. Eric Mazer. Today on Helath Talk, we're going to be talking about pelvic health. Joining me is Adina Leifer. She's a pelvic physical therapist with the Pelvic Health Center at Norwalk Hospital. Welcome to Helath Talk. It's really good to have you here, and good to have you join Norwalk. I know you're new.
Yes, thank you so much for having me here. And
now, pelvic physical therapist. I've been involved in the discussion about our Pelvic Health Center, but I must say, before I started to talk to the chair of our OBGYN department, I had no idea that such things existed as pelvic physical therapists. Tell me a little bit about what is a pelvic physical therapist?
So pelvic physical therapy is really the same thing as a regular physical therapist. We treat muscles and issues that happen, but we focus on the area of the pelvic region.
So you are a physical therapist. You were trained as a conventional physical therapist and then did extra training in the pelvic muscles.
Correct, yes.
No, I think most of us don't generally think of the muscles of our pelvis. What do they do?
So most people don't even realize they have muscles there. And basically the pelvic muscles are what's holding up our entire organs, in the abdominal area. It helps us with bladder function, with sexual function, and they really do support our body.
And even our bowel movements.
Exactly.
I mean, I learned this in medical school, but we talk about the pelvic bowl. If people can think of a skeleton, they can think of the pelvis, but then it doesn't have a bottom on it.
Right.
And the muscles are what provides that all of that support, isn't it?
Yes, exactly. The muscles really hold up all of our organs in that area. And when they start getting weak, they kind of loosen up a little bit and loosen, and then our organs can kind of fall down, and that's when we have issues.
And there are lots of different issues that can occur. Before we move on to the issues, though, I'm just curious. It seems like such an unusual area to have interest in. How did you get interested in the physical therapy of the pelvic floor?
Well, I was a orthopedic physical therapist treating many patients with low back pain, hip, and I kind of realized I was missing a piece of that picture, because sometimes when someone has back pain or hip pain, then it's kind of connected to their pelvic region. And there were women's health courses being offered, and I kind of took advantage of that and was opened up to this whole new world of pelvic physical therapy, where we really kind of incorporate treating the abdominal, back, hip area along with the pelvic region to really treat symptoms of pain and bladder dysfunction.
And that's what I wanted to now get into. There really are a number of disorders that can be addressed through physical therapy for women, and we'll talk about men too. We don't get left out entirely.
Yeah.
But what are the most common patients that you would want to see or that you see?
Right. I think the most common issue is really bladder issues, sometimes bowel, where someone has incontinence, where they leak urine. They sneeze, laugh, cough, jump. They're taking exercise, classes. I know a lot now is very common to have Zumba or spin, and they're taking these exercise classes, and all of a sudden they walk out and they're leaking urine. So they want to stop that, especially as this can happen at a young age or at an older age. They want to really fix that before and kind of treat that issue with the muscle weakness.
And this is more common in women than men, is it not?
Yes, I would say it is. It can happen in men also, and that's usually related to any prostate issue that a man would have. But men can have pelvic pain, and I also do treat pelvic pain issues, people that have pain in their pelvic area, pain with sex and all that. So men can have the same problems.
So maybe we could start with incontinence and the sort of the complex system that allows us to, and by the way, what that means is you leak urine.
Exactly.
And there were two kinds of urinary incontinence. Do you want to just mention those at least, and
Sure.
where physical therapy
Yes.
fits the best?
So there's stress incontinence, and that's when someone would laugh, sneeze, cough, and they would leak a little bit of urine.
And maybe just point out that when you're laugh, sneezing, or coughing, you're increasing the pressure.
That pressure in your abdomen, sure, and then bearing down on the area. And if your muscles are weak there, then it allows urine to leak out. Can also happen with bowel, same exact issue. You could have a bowel stress in incontinence. The other type of incontinence is urge, and that's when you constantly feel the need to go to the bathroom, and you don't feel like you're even.
That's the bladder being spastic, right?
Yes, that could be the bladder being spastic, or it could be that there are actual muscles there that are too tight, and they're kind of spasming around it, and they're not letting all the urine go out when you have to go to the bathroom.
So, someone is sent to you with incontinence. Do you do an evaluation? How do you figure out whether the muscles are tight or loose, and which kind of incontinence it is?
So first I would just speak to them, find out what their actual symptoms are, and then we use what's called biofeedback. And that is a sensor that's placed internally in the vaginal wall, and we have patients kind of squeeze that muscle, and we could see on our little computer how they're doing, if they're weak or if they're too tight, and we could kind of measure that way, and then we could have them exercise with using the biofeedback, so they could really see if they're exercising properly and using those muscles in the correct way.
Well, that's very interesting. So does the patient go home with the biofeedback monitor so they can do this at home?
They can. Most patients don't. They would do it in the actual physical therapy office, but they can do it at home if it really was a really bad case. And they can
we discussed this before the show. Sexual function, bowel and bladder incontinence are delicate issues. People are embarrassed about it, embarrassed to talk about it. How do you deal with that as a physical therapist? Because these really do complicate people's lives,
Definitely.
and yet they may not seek help.
Right. Even when I was treating patients not for pelvic physical therapy, I was treating someone for their back, and then they would say to me on the side, "Oh, and by the way, I have some bladder problems." And I'd say, "Oh, do you want to tell me more about that?" And they'd say, "No, not really," because that was something that was embarrassing to them. They would have to wear, pads because they would be someplace and they would leak. I think the importance is to really get that out there, that most people deal with issues like this. At some point in your life, you're going to deal with issues of weakness or possibly even pain in the pelvic region, and you're not just one person. Men, women, especially women as they age and they don't strengthen those muscles, then you're going to have problems, and it should be something that we all talk about. There's actually a funny comic now that's out on Facebook. There were 3 women sitting around talking, and one says, the likelihood is that one of us just leaked. So it's very common, and the more that it's out there, the more people are talking about it, the more treatment and help people can really have.
Now, women, of course, are different than men anatomically, and they have children, and maybe you could say a little bit about the women's anatomy and the process of pregnancy and delivery that makes them more susceptible to some of these problems.
That's definitely pregnancy can really cause more of a issue on the pelvic floor. If you think about it, your pelvic floor is holding up a lot of your organs, and if you have an 8 or 9 pound baby in there also, you're just putting more pressure on that area and weakening that area.
So you're stretching those muscles, and actually there are even hormones that
even make them
facilitate that stretching.
Yeah, and even the process of labor. As one person once said to me, when that baby's coming out, it's taking along with it your bladder, who knows what else, it's kind of going out with it, and we want to strengthen that area, and pregnancy
plays a large. Is there damage that occurs or can occur during the actual delivery process that can result in incontinence?
Yes, especially with the pudendal nerve is a nerve that's in that area, and during pregnancy or during labor, that nerve can really be hit on, as the baby's coming out. So that can really cause a lot of damage in that area. And there's a lot of research actually being done with that now.
And of course, another difference between men and women is that the urethra, the connection between the bladder and the outside world, which for a woman is relatively short, and a man is much longer
correct.
and has the prostate sitting at the end.
Yeah.
So that it takes less to damage or to create a situation where women would leave than for men.
Right, but I always say that although there's different anatomy there, the muscles are still the same, and just like you can weaken and damage any muscle, a man or male or female, the same thing is that you could really damage or weaken any muscle regardless of who you are.
Now, you also talked about pelvic pain.
Yes.
And I actually had a close friend who had this syndrome, and it was very painful for him. I wasn't really even unaware of this before this happened to my friend, who was also a doctor, by the way. So tell me about that.
I think when it comes to pelvic pain, people don't even know that can be unless you have it or know someone that has it, because no one really speaks about it, and it's so important because people really have issues and pain, and it's kind of ignored. Back pain is more out there than a pelvic pain. But just like you have back pain because your muscle spasm, you can have pelvic pain because your muscle spasm.
And let's emphasize that to our viewers. There are muscles in the pelvis.
Correct.
and again, we were talking before the show, and you said a lot of people don't even realize them.
Right.
There are muscles in the pelvis, and they can have spasm that hurt.
Correct.
So take us from there.
Yes, the same way you could have pain in your neck from stress, tension, injury. You could have pain in your pelvis from stress, tension, injury.
What does it feel like? I mean, for people at home, I'm not trying to be trivial, but what is pelvic pain?
So there's
what should they look for?
Yeah, so a few symptoms would be either just pelvic pain when you're sitting, standing. It can happen at any time. Sometimes people don't realize they have pain until they go to have sex, and then they realize this really hurts, and that's not supposed to hurt. The other pain people have is kind of that burning feeling, and that could be called vulvodynia, which is when the outer portion of the vagina is really red, irritated. That could happen when you kind of go through menopause. That kind of when those symptoms increase, and that's the pain that they would have. So either it could be burning, itching, or just you're sitting and you have pain there.
The pain sort of just in the. They feel it in the groin,
yes.
or do they feel?
Yeah,
can
they
you
feel it in the groin. Sometimes you may have burning when you go to the bathroom, that kind of pain, or you just kind of feel it if you're inserting a tampon, or if anything's being inserted into the vaginal area, then you would feel pain.
How about men?
So men, they feel it more in relation with their prostate. So they may feel it more when they're going to the bathroom. They may feel burning. Or they may just feel it in their lower region,
So I think we've got to wrap up this segment, but I think there's a really important message here, is because as a physician, someone talks about burning, I'm going to think of urinary infection.
Right.
So if you
have to rule that out first.
So if you're constantly going and doctors are thinking you have a urinary infection, but your cultures are negative,
correct,
maybe it's time to think that this is a pelvic pain syndrome. Is that a fair statement?
Yes, that is definitely a fair statement. And sometimes you may even have that urinary tract infection with this, because urine gets left behind because your muscles aren't relaxing, they're all spasmed up. So it can go hand in hand.
Well, this is really interesting. What I want to do in the next segment is talk a little bit about how you treat it, what pelvic therapy is. Then we'll say a few words about the Pelvic Therapy Center. But we need to take a break, and we'll be back right after these messages. And here's this week's health question. Does being overweight increase bladder incontinence? Well, we have an expert on the set. Perfect question. How about the effect of weight on bladder incontinence?
I think weight does play a large role. I don't think it's the cause, but I think it can.
Just because you're fat, it doesn't mean you're going to have incontinence.
Exactly, it doesn't mean you're going to have incontinence. There are plenty of very thin people that have the same problem. I think it does contribute to the problem, because any more pressure on that area is going to just cause more weakness.
And of course, we were talking about coughing, straining, laughing, sneezing.
So if there's more pressure when you're doing that, then that would just cause more leaking and incontinence.
So this is another reason to stay thin.
Yes, and just to exercise and really strengthen. Your abdominal wall really helps with your pelvic function. So the stronger your abdomen is and the less weight there is there, then the stronger your pelvic floor will be.
And that does bring me, I'm just going to extend this question a little bit because I asked it to you off air. Pregnant women, should they all be doing pelvic floor exercises?
Yes, I would say maybe not while they're actually pregnant, but after they have the baby, then you should definitely, and this is even speaking from my own personal experience.
You have 3 children,
I have
right?
3 children, and yes, after you have a baby, that's when really you can kind of see where that weakness is. So the key is really to get everyone exercising right after they have babies, because that's when they're probably weakest.
Is that advice routinely given to women? Are they the proper exercises?
I don't think so.
So how do they get that information? I mean, there's only one of you.
Right. I think the more we get it out there and the more we say, look, if you kind of fix this early, if you don't wait till you're 65, if you kind of, after you have
65 isn't so old.
Correct. But if you wait, if you don't wait, and you kind of have your children, and then you immediately start doing exercises, that just prevents any issue from happening later. Not to say that when you're older you cannot fix this problem, because you can. Any muscle can be strengthened at any time. But if we could prevent issues, then
that's enormously helpful advice. So 2 pieces of advice here: stay thin. And the other one, though, is I think after you've had a baby, that it's important to consider doing pelvic exercises. I wish we had more time, because this is really all new information for me. If you at home have a question you'd like to ask on Health Talk, please contact us at healthtalk@norwalkhealth.org. I want to thank my wonderful guest today, Adina Leifer. I'll see you next week on Health Talk. Stay well and exercise our pelvises, I guess, huh? That's the message. Bye-bye.